Welcome to the first Friday coffee break with the Community Indicators Consortium. CIC is a central knowledge and organizational hub for community indicators projects, helping to advance and support measurable, equitable, and sustainable improvements in the quality of community life. I am Marty Romiti, Managing Director for CIC, and on the first Friday of each month, we take a short break from our day to learn about the latest projects, data tools, and key issues happening in the world of community indicators. This month, we will hear from Dan Treglia about the ALICE Essentials Index, as presented to the Council for Community and Economic Research and Labor Market Information Institute, along with CIC. When policymakers lack the right tools for the job, policy suffers. Official economic markers often do not adequately measure the realities that low-income families face, which essentials they need to live and work in the modern economy, and how the costs of those goods have changed over time. The asset-limited, income-constrained, employed, or ALICE measure helps to fill this gap. Dan Treglia is a senior research fellow at United for ALICE and Associate Professor of Practice at the University of Pennsylvania. Dr. Treglia's work focuses on the use of quantitative methods to better understand and address a range of social policy issues, most notably homelessness. He has a doctorate degree in social welfare from the University of Pennsylvania and a master's degree in public policy from Harvard's Kennedy School of Government. Thank you again for tuning in to this month's CIC Coffee Break.
What is ALICE? What does that mean? And who is ALICE? And that'll make a little bit more sense in a few minutes. And then we'll talk about something that we've created called the ALICE Essentials Index. And then we'll build on that to discuss the measurement and kind of subsequently the policy implications of this work and how we can be kind of better measuring income insufficiency, income inequality, and better kind of meet our policy needs. Okay, so United for ALICE, and ALICE stands for Asset Limited, Income Constrained, and Employed, has been doing this work from 2007. And this began just looking at a small county, a small area in New Jersey, trying to understand income insufficiency there. And this was a well-off county, but we know that just because a county looks well off doesn't mean that everyone there is in fact well off, and there were people struggling. And sure enough, that initial research found that a large percentage of that county, New Jersey, was having difficulty making ends meet. And that grew to the entirety of the state of New Jersey, and now the entirety of the United States. We have data for all 3,000 counties, a little bit of which we will discuss in the next, we'll be presenting for about 25 to 30 minutes or so. And then we have some very, very deep data for 21 partner states. And in addition to just kind of doing some number crunching, we try to create kind of a learning center, a learning community around the data that we create by working with our partner states and other partner nonprofits and foundations to better understand the lives of and circumstances of people and households that are having difficulty making ends meet. In response to COVID-19, we've also set up the ALICE Recovery Fund to help those people, help those households that are having difficulty making ends meet. Okay, here are a bit of our goals, and I think this gives you a sense of what kind of organization we are and what we're hoping to do. So for one, we're hoping to change the standard measure by which governments and nonprofits think about financial insecurity. We'll talk a little bit in a second about the antiquated federal poverty level, and that is the basis for almost all financial and other assistance. So we want to move away from that. We also want to move away from talking about the working poor to ALICE. Okay, and we want to shift a public policy agenda to one that actually meets those needs and provides not just a couple of dollars out of poverty, but actual stability for ALICE and other financially insecure households. And we also want to make sure that we are valuing kind of all jobs, not just a subset of jobs. And we've done some more work on that we can get into, and make sure that that work can actually support the households in which people are living and that they can buy the things that they need and then some. And again, we want to create a learning community. We don't want this knowledge to just stay in our small group, but by having conversations like this and by working in depth with our state partners across those 21 states, we make sure that our information gets from us to those nonprofits and then into those counties, and that it's used at every part of the policymaking and practice development process. Okay, so I think it is fair to say that policy is not where we need it to be. And that is an unfortunate thing to say. And a lot of that comes from how we measure, right? You solve the problems that you know about the problems that you measure. And we do not do a good job of measuring actual financial need. The federal poverty level was developed in the 1960s by an economist at SSA named Molly Orshansky as a way to understand need and evaluate the policy efficacy of the Great Society programs being developed at the time. And it was simply looking at how much money the average family spent on food, as food was about a third of the budget, and then multiplying that by 3. That became the standard in 1969. And because that's what we measure, that is A, the basis for a lot of assistance policy, and B, that is our focus. We focus as a policy and at a federal level and on a state level and often on a local level of trying to ameliorate literal poverty rather than providing for stability and addressing the broader household needs. Okay. But there are certain gaps that are not kind of addressed here. One that I mentioned here, and you can see here, is the geographic inequality. So on the left side of each is the federal, on the left side here, we have a graph connecting the federal poverty level to the cost of living in Randolph County, Indiana, with New York County or Manhattan in New York. This is the FPL. This is data from a couple of years ago when the federal poverty level for a family of 4 was $24,300. Even that was only half the actual cost of living for a 4-person, that's 2 adults, 1 child in 1 toddler and 1 infant in Randolph County, Indiana. And then you would still have to go another whole federal poverty level to cover the bare minimum cost of living and working in New York City, or New York County, I'm sorry. And part of the problem is that many essential expenses like housing and childcare are not included in the federal poverty level, or even some alternative poverty measures, including the supplemental poverty measure. And again, you can see on the right side here, how some of those essential costs are not factored in. So, and how those differ from place to place. So in Randolph County, for example, housing might cost $650 a month. In Manhattan, we're talking about 3 times that, give or take. And the same is true for childcare. Okay, so there are huge gaps here. The geographic inequality certainly being one. Another being that food no longer represents about a third of the average household's budget. It's now about 10 to 15%, give or take. So there's a big gap there that we're not fully understanding. Okay, so we've created this alternate measure, that's ALICE threshold, to better understand the actual cost of living. And we've done that by using publicly available data sources to A, make this replicable, and B, certifiable, so we can understand what these costs are at a county level. And everything that we're doing is at the county, or the base of all of our work, the base of all of our measures are at the county. So for housing, for example, I'll go through a couple of these. For housing, we're looking at HUD's fair market rent, which is the 40th percentile. For childcare expenses, we're looking at registered family childcare homes, not even the licensed homes, and we're using generally publicly available market rate surveys to do that. Food is based on USDA data. You'll notice that if you look through this list, we're not including savings here. We do have a miscellaneous 10% category to cover cost overruns, or maybe the odd expense that comes up here and there, but there is no opportunity for ALICE to get ahead. Okay, so that's the basis of our ALICE threshold. Households making less than this are either in poverty if they're below the federal poverty level, or they are ALICE if they are somewhere between the federal poverty level and what it actually costs based on this definition. Okay, and as you can see here, this household survival budget, which is what we call this kind of addition of expenses, that's the household survival budget, far exceeds what kind of most low wage workers are making. So again, here we have this as a monthly breakdown. The federal poverty level, which is about $2,092 a month. And then we have two different families, both with both parents working or both adults working, working kind of low wage workers, all making more than $10 an hour, one even making more than $15 an hour, and still unable to afford the bare minimum to live and work in the modern economy for that family of four. Okay, so ALICE costs are outpacing living expenses. Okay, and now let's move on to something that's actually very exciting and very new for us. Is we will soon be releasing our national report. We have not put out a national report before, so we're very excited to put out this national report that summarizes the entirety of the United States, looking at all 121 million households. And what we see is that while 13% of all households in the US make less than the federal poverty level, an additional 29% of households are what we call ALICE, right? That means they're making more than the poverty level, but they're not making enough to make ends meet. Or in total, 42% of US households are not making enough to cover all of their expenses, okay? And again, we're not talking about stability, we're talking about just making it through the month. And they are everywhere, okay? There is no county in the United States. This is a county level map. The darker the county, the larger proportion of ALICE households there are in that county. And while there are certainly some counties that are lightly colored, we can see that ALICE lives everywhere, and ALICE is everyone. Okay, there is no demographic group that is an exception to this trend, to this phenomenon. There are certainly some groups that are more at risk of being an ALICE or poverty households. So in particular, and especially because we're talking so much about racial equity these days, Black and Hispanic households are greatly disproportionately more likely to be ALICE or poverty than white households. And by the same token, middle-aged households are more likely to earn above the ALICE threshold or make enough to make ends meet compared to the youngest and oldest households alike. Okay, let's look at how this has changed over time. This is a graph showing the total number of households in New Jersey from 2007 to 2018, okay? And we're highlighting New Jersey here because we're about to come out with the New Jersey report. And so this first time period from 2007 to 2010 covers the Great Recession. And then from 2010 to 2018, which is the last year for which we have data, generally available through the American Community Survey, covers the recovery. Obviously, we're not into COVID territory yet. But what we can see is that while there was an uptick through the Great Recession in poverty and ALICE households, as you would expect, but in fact, those increases largely continued even in the period afterwards. Okay? And you can see that both in terms of absolute numbers and as a percent. In 2007, there were 28% of New Jersey households were below the ALICE thresholds. And by 2010, that number was 35%, and that did not go down. In fact, it went up. And for all years from 2012 through 2018, 37% of all New Jersey households were below the ALICE thresholds. And kind of even more startling is that 14% of all households are on the cusp of the ALICE thresholds. either immediately above or I believe immediately below. And that essentially means that there's this large group of households that are just teetering on the edge, and based on the day or the month could end up making it or not making it. And also this disparity and the fact that 37% in New Jersey and 42% of US households aren't able to make ends meet explains some of the reason that so many households are struggling right now during the COVID-19 pandemic. I think it comes as no surprise to the people watching and listening to this that that we have kind of fundamental economic issues in the United States, and that many households do not have the savings to get through a month or two, and we're living on the edge, and there were not the kind of adequate supports to keep them afloat in the in an event like this, and that's kind of what we're seeing right now. And certainly a large body of economic research suggests that income insufficiency, when it is large, creates and exacerbates recessions. And again, we're seeing that at this moment. Okay. I also think that it comes as no surprise to the people listening to this that ALICE workers, right, those working low-wage jobs, struggle to kind of bring home both steady, consistent paychecks and deal with kind of life situations that might make it more difficult for them to work. So we see large fluctuations in schedules, even for people that have full-time work. Many of them also go without benefits like health insurance or paid sick days. Right, huge disparities by race and ethnicity, things that we've covered before. We talked about that ALICE has very little or generally no savings and assets, and that is true. That is unfortunately true across our population, and it's especially true for this group. And they have difficulty kind of just getting to work, and a lot of that has to deal with childcare issues, or maybe if they work in a small business, as many ALICE households do. Those businesses have been especially vulnerable to economic fluctuations generally, and to this extended recession specifically. And oftentimes, ALICE workers or workers in general are required to pay for their own right now things like PPE, personal protection equipment, and they may not have the money to do that in order to go make that paycheck, or they may be living in overcrowded housing where someone that they live with has gotten sick and therefore they can't go into work. Something that we'll also talk about in a second is what we call the ALICE Essentials Index, and essentially it's showing that the cost of household essentials are increasing faster than the cost of goods and services generally, and B, that it's increasing faster than the rise in wages. Okay, we can take a look for a second at some of those employment fluctuations, particularly that the number of low-wage jobs is increasing while the number of high-wage jobs is decreasing. And this is a trend that we've been seeing largely since 2007. We have three lines here. Our dark blue line represents jobs that do not support a household survival budget for a family of four, even with two earners. Okay. The number of jobs meeting that criteria has increased by 63% from 2007 to 2018. Okay, about 350,000 jobs to about 580,000 jobs. Okay, our light blue line are the medium wage jobs. That is a job that does, in fact, support a family household survival budget, so that bare minimum with two earners. And that number has decreased 2% from 2007 to 2018, but that dipped from 07 to 10, and that seemed to be making some slow comeback in the years since 2010, especially since 2014. But the number of gold or high wage jobs where just a single earner can support a family of four has decreased by 27% since this period. And that's fluctuated a little bit in the period since the Great Recession, but you can see that even from 2016 to 2018, that was on a downward shift. Okay, and now we can see this as a percentage of jobs. So we're not looking at absolute numbers here. We're looking at each of those occupations or each of those kind of wage categories as a percent of all jobs. And you can see the dark blue line, the dark blue bar growing as a percentage, and the right? The light blue bar staying about the same but shifting up. In the gold bar, those high wage jobs is shrinking and shrinking, almost kind of being squeezed out. And the number and the percent of jobs that are low wage jobs has increased from 34% in 2007 to 50% in 2018. And as I mentioned a second ago, it is not just that jobs are paying less, but that basic costs are rising. Okay, and so the standard used to measure the cost of living is generally the CPI, the Consumer Price Index, but that measures items and services purchased by households across the income spectrum. And what we want to do is capture just what does it take to make ends meet, to afford the basics, and how has that changed over time. But our household survival budget, right, is our kind of point in time, our snapshot. And now we're calculating that over time as an index. Okay. And while the CPI has increased by 1.8% on an average annual basis, our ALICE Essentials Index, just the cost of things like housing and food and healthcare and childcare, have increased by a rate nearly double that at 3.4% annually. Okay. And you can see that has also increased quite a bit more quickly than the increase in the cost of wages for a retail sales worker. Okay. We also wanted to compare this to some other metrics. There are a few out there, so we're comparing this to the Consumer Price Index and 3 others: the Everyday Price Index, Billion Prices, and the Cost of Thriving. And all of these seek to measure not exactly the same thing, but they all seek to measure changes. And what we're seeing is that the cost of essentials, the cost of just the basics, is increasing notably faster. So if we start our index at 2007 at 100, the ALICE Essentials Index ends up at about 145 by the time we get to 2018, while the Consumer Price Index, the next highest score, ends up just over 120. Again, just half of the increase of the ALICE Essentials Index. Okay, and this has remained constant for both urban and rural counties alike. That I think, as everyone here would expect, it costs more to live in an urban setting than it costs to live in a rural setting. But the amount that it has changed since 2007 has increased. You can see that those lines are largely parallel. And maybe the cost is kind of increasing slightly more in urban settings than rural settings, but not by much. In general, we're seeing kind of parallel increases in urban and rural areas. So while rural areas might in fact be cheaper, the struggles that rural families, that rural households have are only getting harder over time. And this has enormous policy consequences because inflation is used to benchmark increases in things like Social Security, civil service and veterans benefits, things like SNAP and TANF, tax credits like the EITC. And so as a result, ALICE households are worse over time. And those, because assistance programs, someone's ability to get those programs decreases over time because those benchmarks are not keeping up. And B, presuming that a household does qualify for a benefit like SNAP or TANF, the amount that they are getting through those benefits is not keeping up with how much it costs just to cover the basics. Okay, and so you can learn a lot more about this on our website, unitedforalice.org. We have the URL on the top of the screen here, and you can find out about all of our partner states, check out more about the ALICE Essentials Index, and learn about our methodology. I'm sure something that interests many of you, all on our website. And this is our closing slide, and it's just the big picture that we have so many households that are below the ALICE thresholds, and they struggle in the best of times, and they are kind of the worst off in certainly in the worst of times. And there are we live in a nuanced and complicated social and economic environment, and there are factors that widen that gap and factors that close that gap. things that increase risk for workers and regressive tax systems and predatory lenders that make it harder for ALICE to no longer be ALICE, to get them to a place of stability. But there's more that we can do by providing quality and affordable healthcare and efficient financial tools and affordable childcare for working families to help ALICE families kind of achieve the stability that they need and we need for them and for everyone.